The garage behind Sharp Chula Vista Medical Center houses crucial emergency equipment, portable sinks, room dividers, and military-tested tents. Senior Safety Management Specialist Kathy Muth says it can all be assembled in a back parking lot for a sudden surge of patients.
An increase of patients that impacts our ability to take care of our patients.
Like a disaster, major accident, or an outbreak of a common infectious disease.
Primarily, we've used them for exercises, thankfully, but we have also used them a couple times for during the flu season.
If the hospital notices more people are coming in with flu symptoms, it can divert them to the tents to keep them from bottlenecking the system.
It gives the emergency room a little bit of breathing space.
The breathing space is one part of the county's capacity plan to deal with the ebb and flow of the region's urgent medical needs, from an unpredictable earthquake to the annual flu season. Officials monitor real-time data to spot when the healthcare system is stressed and take action to prevent it from becoming fully overwhelmed.
This is a measure of how busy our hospitals are.
Inside the county's Division of Emergency Medical Services, senior epidemiologist Joshua Smith is monitoring transfer of care data. That's how long it takes paramedics to hand off a patient to hospital personnel. Is that minutes?
Those are in minutes, yep.
It was within normal range during a recent October visit.
A little over 19, right?
But the busier hospitals get, the more it grows.
And so we're looking for a spike actually up above, it's 21.33 is our official level that concerns us.
Emergency Medical Services Medical Director Dr. Christy Koenig says data points like this serve as an early warning system that hospitals are reaching their capacity.
Because it's taking longer for the paramedics to deliver the patient to the healthcare staff at the hospital, it also means that it takes longer for them to be available to respond to the next 911 call.
This tells her it's time to implement actions outlined in the capacity plan to alleviate the pressure.
Potentially waiving requirements that I, as the EMS medical director, would have authority at the local level to waive for how many paramedics respond.
Instead of 2 paramedics, maybe 1 is sent along with someone who has less advanced skills. The plan is designed for any sort of disaster, but was developed in 1997 to help manage a flu outbreak. And the plan has improved each year, especially since 2017, when the county experienced what senior epidemiologist Smith calls flu-mageddon.
Our duty officers were being bombarded with reports.
It was one of the most severe seasons on record. And after it peaked, Smith looked back at 911 call volume, transfer of care time, and other metrics to identify when it started.
But what we were able to do is take the data from that year and look at it retrospectively and then apply our current system of using metrics and trigger points. And we realized we would have picked up the flu-mageddon about 2 weeks early that year and been a little more prepared.
This year, flu activity is above average, but well within the medical system's capacity. That means at Sharp Chula Vista, the surge tents remain in storage. In the meantime, emergency room Dr. Karar Ali says the hospital already has an internal system to mitigate any patient surge from the flu. There's a separate emergency room team to triage less severe cases.
It became an asset, an indispensable asset during the flu season.
Instead of waiting among patients in dire situations, people with flu symptoms are diverted to the team that addresses only mid-level patients.
I mean, they're in and out, in a very short amount of time.
That keeps patient satisfaction up, emergency staff morale high, and can help keep the county from triggering its capacity plan. Tarryn, Mento, KPBS News.